This is a typical rib. We first learn about the anatomical position. So you have to hold it like this in a way that the posterior end is slightly higher than the anterior end and the posterior end is on the posterior side. So the anatomical position of a typical rib is, this is a typical rib. First one is a typical rib of a right lung, okay, and then this is angled, twisted and curved. It has a costal groove on its lower surface. Upper border is rounded and the lower border is sharp. The posterior end is slightly higher than the anterior end and the posterior end is slightly closer to the midline. And now we learn about the parts of the typical rib. So this is the anterior part. Anterior part has small depressions and it attached with the costal cartilages. This is the shaft, and the borders are superior border and inferior border. Superior border has two lips, outer lip and inner lip. The outer lip give insertion to the external intercostalis muscle, this one, and the inner lip give insertion to the internal intercostalis muscle and internal intercostal intimus muscle. And this is the low inferior surface. It has a costal groove on it, and this lodges the intercostal vessels and nerves in a way that about to downward the series is intercostal vein, intercostal artery and intercostal nerve. This is a posterior end, and it has a head, neck and tubercle. Head has two facets, superior facet and inferior facet, or upper facet and lower facet. Upper facet articulates with its upper facet is a smaller facet and the lower facet is a larger facet. Upper facet articulates with its higher vertebra, next higher vertebra, and lower facet articulates with the corresponding vertebra. This is the neck part. Neck is like, it has two borders and two surfaces. This is the upper border of the neck, lower border of the neck. This is the posterior surface of the neck, anterior surface of the neck. So upper border is crest like, lower border is rounded, and then it surfaces. The posterior surface is rough and pierced by foramina. You can see the foramina on the posterior surface of the neck. Now tubercle medial articulate, later non-articulate. Medial articulate part articulates with the transverse process of a corresponding vertebra, and later non-articulate part is rough and it give attachment to the lateral costo-transverse ligament. We have three ligaments: superior costo-transverse ligament, inferior costo-transverse ligament and lateral costo-transverse ligament. First, lateral costo is on the lateral side, lateral part of the non-articulate tubercle, and superior border give attachment to the superior costo-transverse ligament, and the inferior border give attachment to the inferior costo-transverse ligament. And this is our atypical rib. Done.